As a parent, you've likely seen the rise in chronic health conditions in our kiddos and started to wonder why. Why is there more asthma and allergies and chronic immune challenges? Why are more kids diagnosed with anxiety and ADHD, sensory processing disorder, all the way to autism? If you go to your pediatrician or your family doctor, which is the common spot most parents go initially, they can be great at giving you a label and a diagnosis. However, the challenge that we see with most parents we talk to is when you then start to ask them, why is this happening? Why do they have that diagnosis? You start to see their system falling short. Maybe the finger is pointed at genetics. And as a parent, with your mama gut, your daddy gut, it just doesn't sit right because you think, well, genetics haven't changed a lot in the last thousands of years. How can all of a sudden, in these few short years, we see such a rise in all these challenges? Maybe as a parent, you have chronic stress and you feel kind of run down and tired and lethargic. You get headaches, feel bloated, you just feel off. And again, you start to wonder why. So you start to venture into the more holistic realm, the natural, the Crunchy Moms on Facebook group. Maybe you've seen a webinar on essential oils and you've started to incorporate these things. Maybe you've got your own garden and you feed your family whole foods instead of all processed foods. Maybe you started to cut back on screen time. And the more you start to explore these things, likely you've started to see changes with your kiddos and your family. However, if you're watching this, you might find that there is still a missing piece. You feel like you're stuck and not able to get to that next level. So what I want to share with you today is what we look at when it comes to the why behind these things in our office and the pattern that we see as the missing piece for so many parents in our community. So when people come to see us, we're going to, of course, check on all the different things that they've been doing. And we're going to dive a little bit deeper to go into what kind of stress they're under. Because this is definitely the common theme, no matter who you talk to out there, is we're under more stress than we used to be under. Whether it is our fast-paced society, whether it's deadlines and expectations, whether it is just the go, go, go and all the activities we have our kids in. Maybe it's the extra screen time or the processed food. All these things are coming at our system. And what happens is when we're under more stress than we can handle, it starts to become hardwired in our nervous system. This is exactly what we look for in our office. And the term we use in neurologically based chiropractic is subluxation. What I want you to think of when it comes to subluxation is over here, stress stuck on. When we're under chronic stress, our nervous system starts to become wired for that fight, flight, or that sympathetic response. And most of you have heard, like, it feels like we're being chased by a tiger, even though there's no tiger actually chasing us. That's because of this fast-paced, stressful environment that we're in. It's adding fuel to the fire. And so, as you go down that holistic route, you have likely started to identify some of these hidden stresses. And as I've talked about, maybe you started to clear them out and get them out of the way. And as you start to see change, it can be great. For some families we see, they make those changes and boom, they're off to the races, they're doing great. However, if you feel like you've hit a plateau or there's something you haven't quite gotten to the next level with your kiddo, that can be because this stress, even though you've removed a lot of those stressors, starts to become hardwired and stuck on in the nervous system. So what happens when this takes place is your nervous system can shift into running the fight-flight response on autopilot in the background, even when the environment is pretty peaceful. This is something you may have heard the term dysautonomia. It's when the nervous system is shifted and that fight-flight starts to take over. There's four main things that we start to see happening when this takes place. Number one is if fight-flight is stuck on, it's going to shift your gut and your digestion. Motility, that's the movement of the gut, goes way down. So whether it's reflux, bloaty belly, constipated, all those things can happen if your gut's not able to move food through. If it really starts to get off for a long time, maybe it shifts into autoimmune challenges. Talking about the immune system then, next up is when the nervous system is stuck in fight-flight, it also shifts the immune system. You see, the immune system should be able to recognize, is it a virus, is it a bacteria, and be able to fight off the common cold, fight off the flu, clear those things out in a relatively efficient manner. When stress is stuck on chronically in the body, it now shifts the immune system to looking for a wound or an injury, and it shifts it away from the common cold and the flu of detecting and fighting those things off. As a result, maybe your kiddo is always congested, always stuffy, always full of allergies, because their immune system isn't in a balanced way anymore, because their nervous system isn't in a balanced way. Number 3 is the motor system. These are the muscles in our body. As an adult, you've probably experienced tension in your shoulders, in your back, in your head, because that stress, if it's stuck on, is telling the muscles to rev up, to take action, to hold that stress and be tight and tense. Now, if we translate that to our kids, it might not look like back pain and headaches like we as adults may experience, but that tension can start to make them more fussy. So maybe you notice with behaviors and moods. Maybe as an infant, they're tense and tight and they don't move and they're colicky. As the tension feeds stress into the brain. That's one of the things we see with sensory kiddos, with ADHD, anxiety, autism, is when the environment is under control, but their brain is still experiencing stress, often it's coming from inside the body. There are 2 terms here. One is proprioception. That's the freedom of movement in the body that feeds calm into the brain. When that's not happening, it can go into something called nociception, which the brain can perceive as pain, but often in kids we don't necessarily see it as pain, so it's perceived as stress. And that wiring inside the body can wire that stress response to continue inside the brain. The 4th piece then is sleep. If we're under stress, if there's a lot on our mind, if the gas pedal is turned on, we're not going to be able to slow and calm down and drift off to sleep. So maybe you're reliant on a sleep med or melatonin. Maybe your kiddo tosses and turns and takes a long time to fall asleep or wakes up many times throughout the night. The challenge when we're not getting sleep, as you're well aware of, our body can't shift into that healing mode. So stress stuck on means the gas pedal is revved up, sleep starts to suffer, and it pulls us away from rest and digest, which is that brake pedal. It's the vagus nerve. It's the calming, slowing things down. Rest, digest lets our gut move food through. It allows us to get deep sleep. It allows our bodies to recover and repair and get back on track. Get ready for that next day. So these 4 things are some of the things we see over and over again in our office when someone's nervous system is in this subluxated state, when that stress is stuck on. If you look back at your kiddo as an infant, we'll maybe see kiddos that have a lot of reflux, they're colicky, they don't nurse well, they don't latch well, they don't digest their food well, they had trouble taking naps or sleeping. As a toddler, we might see the motor start to show up where they're not rolling, crawling, walking, hitting their milestones as expected. Maybe they turn their head one way, but not very easy to the other way, so they always rolled one way to start out. Toddlers, you start to see the terrible twos, the tantrums and the meltdowns, and if you find, wow, these are intense, these are extreme, odds are it's this stress is already starting to get wired in their nervous system, so what could be a little meltdown, a little tantrum, suddenly becomes a full-blown issue. Sensory issues start to show up in toddlers. So we move on to grade school. Now you have a kiddo that's supposed to be sitting still in class, supposed to focus, pay attention, and if their nervous system is revved for stress, they're going to be moving all the time. Tough to focus, tough to sit still. Now some anxiety might creep in. Maybe you're seeing the other kids get sick and they kick it in a week, but your kiddo just stays congested. Maybe they had a lot of ear infections as an infant, and now it's just like sinus infections or colds that last weeks and weeks and weeks. And then you fast forward to teens and adults, and when the nervous system has been in this stress mode long enough, now we see that anxiety start to become accompanied by depression. Teenagers that aren't excited or motivated, they're just tired and fatigued and run down. They have the energy to look on their phone, and that's about it. And so one of the things we get so passionate about in our office is when we can trace back and actually see the root of this stress building up in the nervous system, and not only uncover the cause, but help parents understand how to clear out those old stress patterns, we start to see such amazing changes. We start to see immune systems clearing things out. We start to see digestion on track. One of the first changes we often see is better sleep at night. As we take the foot off the gas pedal, start to apply the brake pedal, your kiddo's nervous system starts to go into healing mode, and behaviors improve, focus improves, mood improves. All these changes that you're looking for as a parent can actually take place when the nervous system is doing what it's supposed to do. So if you find your kiddo is maybe wound up, they're worn out, and you're looking for help, that's where I'd love for you to reach out to our office. We have a set of very safe, very gentle neurological scans that we do on your first visit that help to see exactly what state your kiddo or yourself, what your nervous system is doing. And what state it's in helps us see what we can do to help. So take a look on our website. You can find out more about those scans and reach out if you have any questions or you're ready to get that assessment and see what we can do to help get you back on track. I'll see you soon.